I'm now going to show you how to allergy test using the actual foods. We use these because there are no commercially available skin prick solutions for these substances. I'd have it all prepared before the patient came into the room because it's very important that they are kept separate so there's no possible likelihood of cross-contamination. So you would do it exactly the same way using a negative control, and you can do it at the same time as you do the solutions. So you just mark the person's skin and you would again finish on the positive control. So here I'm using the negative control to start, followed by the available solutions, for example, house dust mite, cats, and all the other foods that would be available. And you would then place on the patient's skin the histamine control before taking the lancets and introducing the allergens into the patient's skin. So you go in and out, dispose of the lancet into the sharps bin, at 90 degrees in and out. And then using the lancets from the fruit, you put them directly into the skin. And exactly the same pressure is used, and you finish with the positive control, in and out. Then, in exactly the same way as before, you blot the allergens, ensuring there's no cross-contamination. You then wait for 15 minutes to observe for the reactions that come about on the skin. Once the 15 minutes is up, we need to measure the white wheals on the skin, and to do that I take my pen again and I just mark the area around the outside of the wheal, and starting with the positive and working up the arm, and put dots around the outside, and then we're going to measure them in 2 dimensions. So taking the ruler, this is 10 millimeters by 6 millimeters. That's a 10 millimeter wheel by 10 millimeters. So that's a 10 plus 10 is 20 divided by 2. That's a 10 millimeter wheel. And again, this one is 8 millimeters by 6 millimeters. So 6 plus 8 is 14, so that's a 7 millimeter wheel. We now have the results of this allergy testing. We know that the patient is sensitized to various fruits and aeroallergens, so these results will now be passed on to the allergist, who will take their care from here.